Asha Connect, a telemedicine project for tribal and rural India.
We are inspired by our Prime Minister Shri Narendra Modi's dream of Digital India. We could get this project with efforts of Padma Shri Dr. Ashok Gupta and Indo-American Telemedicine Corporation, promoted by non-resident Indians with their heart and soul in India.
A few of us in America have joined, who are all born, raised in India and got educated in India, and we owe to our motherland, and it is our responsibility to give back to India. We have come up with a solution that is made in India, for India, by Indians, in order to help the rural India.
There are many villages in the country that lack basic necessity of life such as water, electricity, and most importantly, health care. Health care is the right of every individual, but lack of quality infrastructure, dearth of qualified medical functionaries, and non-access to basic medicines and medical facilities, with more than 70% population living in rural areas at low level of health facilities, mortality rates due to diseases are on a high. There is an urgent need of medical professionals to help the rural India. Here comes the Asha. Accredited Social Health Activists is a community of health workers instituted by the Government of India's Ministry of Health and Family Welfare as a part of the National Rural Health Mission (NRHM). They have always been instrumental in nurturing as well as educating the rural India with health and welfare. Ashas are local women trained to act as health educators and promoters in their communities, treating basic illness and injury with first aid, keeping demographic records, and improving village sanitation. Ashas are also meant to serve as a key communication mechanism between the healthcare system and rural populations. The mission is to have an Asha in every village in India. The target translates into 250,000 Ashas in 10 states. There are 859,331 Ashas in 32 states and union territories as per the data provided by the states in December 2014.
Asha Connect, a digital technology that is made by Indians, for the Indians and in India.
Asha Connect, using telemedicine to connect millions to health and welfare. Asha Connect has been envisioned by pioneering doctors. They are based out of different parts of the world, but being Indian, they always understood the ardent need of basic health care to reach the villages of India. They envisioned that the doorway to reach the inaccessible areas of rural India and to satisfy the WHO mission of giving health care to every individual, the only way was with telemedicine and Asha. So while connecting the two essential aspects, emerged the idea Asha Connect. The major problems in rural areas constitute of lack of resources, not enough rural physicians in primary specialist care, infrastructure gap, not enough healthcare centers for the population, poor access to rural areas by roads, lack of diagnostic capabilities at the rural site of delivery of care, lack of standardized documentation, and inability to retrieve information on demand through electronic medical records, and increased travel time from rural areas to urban centers due to financial and other local constraints. Some rural areas have no healthcare facilities at all, and people travel to nearby towns miles away to get a simple checkup. We can easily give every individual their right to basic healthcare through telemedicine system. Telemedicine is use of telecommunication technology to provide basic healthcare from a distance. India is also a nation with large telecommunication networks. Many telecom service providers have enabled access to basic internet and phone network in quite a lot of rural areas. This has made the perfect avenue for telemedicine to facilitate a virtual doctor-patient encounter. These solutions combine voice, video, medical data, and collaboration tools to facilitate a patient to see a doctor without having to travel long distances. Such solutions give doctors tremendous flexibility to divide their time between virtual and physical consultations. Telemedicine solutions are designed to work on a lower bandwidth, enabling healthcare providers to serve patients in remote locations where last-mile connectivity is a lingering problem. They can be set up pretty much anywhere. The solutions can also be set up in a mobile health unit, for instance a bus or ambulance, which would allow healthcare services to be provided to remote locations, circumventing the issue of delay in getting together specialists. These telemedicine solutions allow doctors to capture, store, and retrieve patient details such as demographics, patient history, allergies, clinical findings, vitals, and medications. Readings from the medical devices are made available to the clinician to facilitate a quicker and more accurate diagnosis. The physician or the specialist can also write prescriptions digitally. Asha Connect, a telemedicine technology of its kind. Asha Connect will benefit the healthcare ecosystem by providing healthcare services to places that are beyond the access of doctors and medicines, equipping rural India with diagnostic facilities, improving doctors' access to patients' information, improving healthcare education at a professional level, ensuring transparency to the patient while maintaining privacy, and also empowering locals with various employment opportunities. Asha have also been the backbone of rural India and have been able to access and support the remotest part of rural India. Asha Connect empowers Asha to be the bridge between the patient and the district or tertiary healthcare center. We will train the Asha on using the Asha Connect software. The Asha will collect the basic health information of all patients, perform various wellness tests of all patients. Asha will fix appointments of patients with doctors. The assigned doctor will observe the patient with the tools available with Asha. On necessity of lab work, Asha takes the patient to the healthcare kiosk. Asha Connect creates a seamless link between the on-ground worker, the sub-primary and community health centers, the district and divisional hospitals. The Asha Connect is an innovative diagnostic device to help clinics and doctors to undergo various tests and thereby enhancing patient care. It incorporates a range of diagnostic tests along with diagnostic algorithms and applications for patient registration and their medical records. The Asha will perform the tests with Asha Connect, and the test records will be automatically saved in the system as per internationally approved format. Tests offered by this device: blood pressure, pulse, temperature, SpO2, pregnancy test, hemoglobin test, blood glucose level, blood grouping, urine protein, urine sugar, HIV, hepatitis B virus, HBV test, hepatitis C virus test, syphilis, malaria. Asha Connect is so user-friendly that anybody who knows how to use a smartphone can register the patient and conduct the tests. This is a web-based and cloud-based technology. In the rural India, bandwidth might be a challenge to process the diagnosis real-time through Asha Connect. But Asha Connect has an easy, thoughtful fix for that as well. The device comes with SIM card slots and also with the ability to attach any dongles for accessing internet. The device transports data while using very low bandwidth, so speed is never a problem. Cases where data cannot be uploaded? That's not a problem either. The data can be entered and stored in the device's internal memory, and automatically when the device is connected to internet, the data would be updated in approved EMR format. The device also has access to live video calling for patient-doctor consultation using the Zoom video conferencing service. This conferencing service works on a highly secured network while maintaining a high privacy standard. Another special feature of the device is that it comes with a digital echo mobile stethoscope that can record and update the sounds of heart in the EMR directly. The entire project, with its intent and device, is dedicated in gathering data and records for analysis and examination. This collection of data will not only help assess the health of the patient, but gross analysis of data will help in understanding the health patterns among certain demography.
Asha Connect is a program which connects a remotest place of the country to the most modern part of the country. If a patient from the remotest place wants to access the opinion of a doctor who is sitting in Mumbai, he can get it. This is only possible with a digital platform or technology which is incorporated in a program that is known as Asha Connect.
I am Dr. Kanchan Gupta. We being doctors, we want to give our contribution in this field. We could make use of this technology for the benefits of patient in interior and remotest village of India.
Think globally but act locally, and we are going to create solutions which are aligned with Digital India. So with our telemedicine solution, we are going to connect the rural India to the urban India and also to the world. Created a solution called Asha eConnect. Jai Hind.